I do find strength in the work day to day because I do find it so meaningful. I get a lot of a sense of fulfillment when I know at the end of the day we've done a good job taking care of people. But I also do, at the end of the day, sometimes feel exhausted. And one of the ways that I get strength is still trying to be a part of community when I can. And so those Sundays when I am free, really trying to make it to church. I think that's the really wonderful and surprising thing about medicine is that there are people in it who really want to walk and shepherd others through it. And so I've had the good fortune of having mentors in a lot of different areas, one of which is through the Theology, Medicine, and Culture Fellowship at Duke. I would say I never felt more invested in as a person and as a student than during my time here.
Early on, I think, I was pretty motivated to walk alongside people, to embark on these journeys with them. But I think with time, one begins to realize how affected you can be in this line of work. Just a couple weeks ago, I cared for a young girl who was a victim of gun violence, who died in the trauma bay despite our best efforts right in front of me. And so not only am I trying to care for her family, but now I have to care for my team, for my medical students, for my residents who have just witnessed and participated in this terrible event. And we see that a lot. And I think typically the response in medicine is to develop thick skin, go on, next patient needs you, without recognizing how it affects us and challenges our own ideas about good in the world, about God in the world. So certainly there's been multiple experiences observing the suffering that has certainly challenged, I guess, my views of who I am in the world. At the same point, I've been so encouraged oftentimes by my patients as witnessing their ability to persevere in the midst of great suffering, the sort of gratitude that they'll often have even when the best of our medicine fails. And I think it's those patients who frequently remind me by their faithful witness that perseverance and hope in the midst of all of this is possible. As we think about change within healthcare, I can certainly be overwhelmed with the kind of overarching bureaucracies which seem to dictate how we function, whether that's the insurance companies that I have to go to try to advocate for my patients when a particular procedure is denied, or even hospital systems who are concerned about revenue and bed control and discharge dates, to the pharmaceutical companies and device companies who are trying to make profits, but also by doing so may prohibit access from some of my patients to these things. It can feel very overwhelming as an individual. I'm very encouraged by kind of the community I have at a place like Duke, of like-minded individuals who are pushing up against this. And I think both locally as well as nationally and across different sectors is absolutely important if we're going to see real changes.